In school, I always thought giving milk with every meal was weird. Like giving pizza with milk, who does that? It was very odd to me that milk was on the menu at lunch, but apparently it was the healthiest and cheapest option for schools to all get on board with giving out to students. At least, according to an article by the American Dairy Association Mideast, which says milk is offered as a part of the national school breakfast and lunch programs because dairy provides valuable nutrition in a small and inexpensive package. Schools can choose to offer fat-free and low-fat 1% milk either in white or flavored milk, as well as yogurt and cheese. There are many who want milk to stay on the menu in schools mainly because of its dietary benefits. However, flavored milk has been a concern for growing children because of its high sugar intake and added ingredient of high fructose corn syrup. For example, in 2011, flavored milk was banned from the Los Angeles Unified School District because of the fight against childhood obesity. Today, I will be talking about how flavored milk is a huge problem for young students, how the problem will not be solved on its own, and how we can all help to stop this problem from continuing to get worse. To begin, this leaves me with a big problem with this topic. Flavored milk is a factor towards childhood obesity. As the National Public Radio wrote, the Los Angeles Unified School District voted 5 to 2 on a new dairy contract to remove flavored milk from school menus, the Los Angeles Times reports. This is evident of how this dairy product is a problem. An entire school district decided to remove it from schools. Along with this, an article by the NYC Food Policy Center at Hunter College states, one of thousands of growing sick from sugar one of thousands of children growing sick from sugar in a country where the obesity epidemic has reached epic rates and shows no signs of slowing down. Healthcare costs related to obesity in this country topped $1.72 trillion in 2018. In the state of New York, childhood obesity has tripled over the past 3 decades. 40% of NYC public school students aged 6 to 12 are overweight or obese. From this, we can see that overconsumption of flavored milk is actually leading to diseases in students and causing overweight problems. This directly correlates to how critical this problem is becoming and that something has to be done about it. This article goes on to say, research also suggests that consuming sweetened beverages such as chocolate milk every day can train a child's palate to prefer sugar-sweetened foods. Chocolate milk is banned in Boulder, Minneapolis, Washington, D.C., Montgomery County, Maryland, and most recently San Francisco. Even New York City's Department of Corrections has phased out sugar-sweetened beverages because of their ties to costly obesity-related diseases. These are just some of the actions being taken to help fend off these occurrences in students. If we want children to grow up strong, we must stop their bad eating habits from a young age. As we can see here, all this data overwhelmingly suggests that there is a serious problem with flavored milk in public schools. This is more than enough evidence to show that there are major health concerns with giving out flavored milk to students, and hence why some school districts have already moved ahead to ban it off their menus. Consequently, this conflict will not be resolved on its own because there is no one to stop the children from drinking milk in school, especially if the staff is urging them to take it. Students have been drinking milk with their meals at schools since the 1954 Special Milk Program. This concept of providing a dairy drink with the lunch meal, however, has been around since 1853. Without enforcing the removal of these dairy products, the children will continue this pattern of being overweight or obese at a very early age. Who will stop them if we don't? Where will we turn to once most children have already been affected by their actions and are having serious health problems? We need to take action now in order to prevent worse consequences for our children in the future. Next, we must discuss a plan for how to remove these options from the menu in these public schools. Even though flavored milk is unhealthy for students, I mentioned earlier how regular milk itself does have its health benefits. Therefore, just because we must take flavored milk off the menu, it does not necessarily mean we should get rid of regular milk altogether. With this in mind, lawmakers, school district officials, and government officials must begin to take this problem seriously. Once they do, they can begin to create policies banning the sale of flavored milk in public schools all across the country. Then the schools can continue to distribute regular milk, as it is still a great way to incorporate calcium into students' diets in order to for them to grow big and strong. As an article by the Cleveland Clinic says, dairy products are an important part of the diet because in addition to providing carbohydrates, protein, and sometimes fat, they provide a wealth of vitamins and minerals, including calcium and vitamin D. We can see here that regular milk is still an important part of a child's diet. Yet flavored milk is where the problem lies, and by following this course of action can be eradicated quickly. Finally, we must all come together to do our share of help to begin to reduce this problem with children and adolescents and convince the education system to change their ways. First, we must start by teaching our children young that just because a drink is sweet and tastes good does not always mean that it is good for their health. We can begin to educate our kids about healthy drinks versus unhealthy ones and that it is still okay to have those not so healthy drinks, just not to an overwhelming extent. Second, we could educate ourselves on the nutrition facts of a regular milk carton that our children are drinking at school so that we could be knowledgeable on what they are consuming every day at lunchtime. By simply looking up their nutrition labels, we find all kinds of useful information on what they are intaking and can help regulate how much they drink per week. Instead of the flavored milk they are provided in school, we can instead send them to school with another beverage, such as water or an organic fruit juice. These will be the first steps we can take towards helping them strive towards a healthier future. To conclude, flavored milk is our enemy. We cannot simply ignore the problem anymore because it is already having serious consequences. We saw that it is a leading cause in childhood obesity and obesity related diseases in kids and adolescents. We determined that lawmakers must become aware of the problem and take it seriously in order to begin creating policies that ban the sale of flavored milk in public schools. After that, schools can remove these options from the menu and just continue to provide regular milk to students to meet their dietary needs. Lastly, we figured out how we can begin to change the narrative and begin teaching our children from a young age that sweet drinks are not always good options to have during a meal. Even though we do not have to remove them completely from our lives, it is not good to have them every day. This way, they will understand what foods and beverages are healthy for when they grow up and are more aware of what they are consuming at mealtimes. Considering all these things, we can be confident in having a better understanding of what we can do to guide our children to have a healthier future and push towards the ban of flavored milk in public schools.